I'm Dr. Lisa. We've been trying to understand how people feel about the vaccinations. And today we want to hear if they think the vaccination for COVID-19 is worth the risk. So let's see what people have to say. So do you think getting the vaccine is worth the risk? And if so, why?
That's the whole debate. It's almost like, even if I don't want to, by me having children, I just might have to do it. Or because of the field, like I'm going into medical assistant.
Oh, okay.
Some people require it whether you want to give it or not, and regardless of like your religion or background.
And you know what's going to happen? I'm going to have to get it.
Oh, because of your work.
You want to work? You're going to have to show me your card. You want to get on an airplane? You show me your card. Oh, you didn't do it? Then I can't hire you. I mean, they won't say that, but guess what? Your phone's not going to ring.
So do you think the vaccines are a good idea, or are they worth the risk or not?
I think it's worth the risk to get the vaccine, because I think if everybody get the vaccine, the COVID, the epidemic is going to be gone in about, I say probably a year, 6 months, something like that.
A year? Oh,
Yeah.
I hope not. I hope it's sooner than that, but you might be right. Yeah.
And but I still trust the vaccine, because I think it's going to help us get rid of the pandemic.
I think it is because, personally for me, I don't want to feel the stress of being tied to a ventilator.
Yeah.
So I would take the risk, even though I don't like shots, I don't like needles, but I take this shot with a smile.
You're giving us a vaccine, but then what are people's health concerns? You know what I'm saying? What exactly is in it? How many people can you say scientifically, this I know this is going to work? And then how long does the vaccine work? You know what I'm saying? You got to take a second dose, and you got a lot of apprehensive people who's hearing a lot of different things, like it only lasted 6 months, or you can still get vaccinated again. I mean, you can still catch COVID if you get vaccinated. If I get vaccinated, what is the long-term benefit? Is it going to help me long-term, or is it one of them things where it's going to be long-term, eventually I will have to continually keep getting it?
So you're right. Nothing is 100% ever. But the best we can do is follow what the research showed. And there were hundreds of thousands of people in these research studies looking at these vaccines. So all three of them, Johnson & Johnson, Pfizer, and Moderna, in the research were shown to prevent hospitalizations and deaths, which is the worst outcome possible from COVID-19, right?
Yeah.
So that's what, I think that's what we have to ensure people understand. So what would you say to people who are afraid to get the vaccine or don't think it's necessary?
Don't be afraid. Look at the statistics. How many people we have lost because they have gotten the vaccine, and how many people we have lost due to the coronavirus. The numbers are really, really different.
Today we heard a variety of opinions about whether or not the COVID-19 vaccines are worth the risk. The truth is, the vaccinations help prevent hospitalizations and death. So when it's your turn, you have to decide your risk for you, your family, and your community. If you have other questions about the vaccine, reach out to us at Grapevine Health. I'm Dr. Lisa, and I'll see you on the street.